My name is Reeve Conover, and I'm an employee benefits expert for more than 3 decades. This is a quick primer on Medicare and what you need to know for the upcoming 2017 open enrollment season. Every year, Medicare has an open enrollment period. It begins on October 15th and ends December 7th, so you have a short window to make your decisions. This applies to anybody with a Medicare Advantage plan, a PPO or an HMO, and to anybody on Medicare prescription drugs. The open enrollment period does not apply to Medicare supplement plans. Let's take a quick look at the difference between Medicare Advantage plans and Medicare supplement plans. A Medicare Advantage plan is an HMO or PPO plan. The advantages to this are that typically there's a very low premium, and in some areas of the country, there may be no premium at all. They will have copays for most of the services, but you must use the network that they provide. You must use in-network providers in most cases. A Medicare supplement plan is the exact opposite. You'll have essentially full coverage if you take Plan F, a little less if you take some of the other plans. There may be some copays. Your premium is going to be substantially higher, but you can use any doctor you want. Medicare plans have star ratings, and this is a fairly new innovation by the Centers for Medicare Services. And the real issue is it's a comparison between the types of plans based on a wide range of facts. If you have a 5-star plan available in your area, which I have seen very few of, you're able to enroll in that at any time during the year. So this shady looking character is here for me to remind you that every year you need to look at your drugs and reassess the prescription plan that you're on, because in October it becomes a 3-card money game. They start moving the drugs around on tiers, every company does, and your plan that was perfectly good this year may not be so good next year. And so the big question becomes, is your inexpensive premium plan going to cost you a lot more money because the drugs that you take are on much higher tiers? Every year, we run all of our clients drug lists to make sure that they're in the right place. Several years ago, a major carrier that is very popular stopped covering a very expensive but popular drug. And a lot of people that refused to change because they liked their company ended up getting a lot of money out of their pocket that they did not expect. So here's a chart of how Part D works. There's a $405 deductible at the bottom of this when you first go to get drugs. Some of your Part D plans will cover that, some of them won't, and some of them will cover it partially. So you've got to look at that. Then after the deductible, in the initial period, you'll pay 25% and the insurance carrier will pay 75% until you've gotten to $3,750 total between you and the insurance company. Once your total expenses hits that $3,750, now you go into what people know as the donut hole, the coverage gap, where you will pay a percentage of the prescription costs. And once you do $5,000 for this coming year in 2018, in that coverage gap, that's $5,000 out of your pocket. Then, and only then, do you come out and get covered where you only pay 5% typically. Now, we get a lot of questions about help paying for prescriptions because some of these prescriptions are incredibly expensive. So understand that Medicaid may cover some of these things for you. If that happens, then you're a dual eligible, and there are other benefits to that as well. There's a low-income subsidy option out there that you contact social services to find out for. And you can also contact the pharmaceutical companies because in a lot of cases, they have prescription assistance programs available.